The main consequence of impaired ciliary function is reduced clearance of secretions from the lungs and consequent susceptibility to chronic recurrent respiratory infections. Symptoms include hearing problems that occur in up to half of young children, a runny nose or a nose that is partially blocked by secretions, sinusitis, which is infection of the sinuses, bronchitis caused by infection of the large airways in the lung, and bacterial infections of the lungs such as pneumonia. If left untreated, PCD can lead to a form of irreversible progressive lung damage known as bronchiectasis. In PCD, bronchiectasis is a result of recurrent inflammation caused by infection. The bacteria that cause infection are usually trapped in mucus and swept out of the lungs by cilia. In patients with PCD, bacteria are much more likely to be trapped in the lungs where they can grow and cause infection. Each time there is a bacterial infection of the lungs, the damage is increased, which in turn produces conditions that are more favorable to bacterial infection, creating a self-perpetuating cycle of lung damage. The inflammation caused can damage the walls of the airway, making some of the airways much larger than they should be. Larger airways are a problem because it is even more difficult to clear them of mucus and infection. When the airways become irreversibly enlarged, this is called bronchiectasis. In newborn babies, PCD may present with breathing difficulties, though these often improve spontaneously. Some babies will have been treated on a special care baby unit for a few days because of their breathing problems. At first, the main symptoms noticed by parents may only be a loose cough, a perpetually snuffly or runny nose from birth, and susceptibility to chest infections. It is only many months or even years later that, if untreated, problems become apparent, with recurrent upper and lower respiratory infections. Cilia also line the tubes that connect the inside of the ears to the nose, called the eustachian tubes. In PCD, the cilia that normally move mucus away from the ear cannot do this, resulting in a build-up of fluid inside the eardrum. This may increase the risk of ear infections, otitis media. The fluid that accumulates in the ear can become thick and sticky like glue. This affects the hearing of about half of patients with PCD when they are young. In patients with glue ear who do not have PCD, a small tube known as a grommet is often inserted in the eardrum to let the glue out, and this helps their hearing. In patients with PCD, this is almost universally unsuccessful in improving these problems. All patients should be seen by ENT surgeons with a special interest in PCD-related problems to avoid inappropriate management. As hearing problems in patients with PCD usually improve spontaneously as they get older, it is usually best to help them early on with simple hearing aids if they are needed. A poor sense of smell may accompany high mucus production in the sinuses. As the tail of the sperm is almost identical to the cilia, some males have reduced fertility because of reduced sperm motility. If fertility is reduced in males, techniques to assist conception are now available. Female reproductive function may also be affected because the fallopian tubes are lined by cilia, where they play a large part in moving eggs from the ovaries to the uterus. This may slightly increase the risk of an ectopic pregnancy. Most pregnancies, however, are successful. Indeed, many patients with PCD who are members of the family support group have had children over the last few years. As with the general population, IVF techniques to assist conception may be used if needed. Up to 50% of people with PCD have all the organs in their chest and abdomen located on the opposite side to normal, a condition known as situs inversus. Having situs inversus does not affect the quality of a person's life. A doctor may mention the word dextrocardia. This simply means that the heart is on the opposite side to normal. You should always let doctors know if you have situs inversus, as it is easily missed on examination. Occasionally, this may be important for them to know. For example, if you have situs inversus, your appendix will be on the left side rather than the right side. It is important to understand that being born with this disease leads many patients to needlessly accept the symptoms of PCD as being part of everyday life. In fact, many symptoms can be relieved, and successful treatment of PCD can improve quality of life significantly.